Hello dear student, today in this video I am going to explain the main part of pharmacology that we are going to generally study in pharmacology in B.Pharm, that is about drug. So before that thing we have studied about the what is drug, how the drug is going to act, how that going to administer in our body, distribution, metabolism, how it is metabolized in our body, how body is reacting to that drug. That all we studied in that pharmacokinetic topic. So before going to main topics in pharmacology, I will tell you to go through all that video of pharmacokinetics so that you can understand better that drug actions. So in starting of pharmacology only, I started to tell you that pharmacology consists of two things. One is pharmacokinetics, second one is pharmacodynamics. Dynamics, and pharmacodynamics is the main topic of pharmacology, in which we are going to explain how that drug is going to act. That means how that drug is going to act. So is action in our body, what is their mechanism, how they are creating their action in our body, by which mechanism, and how it is going to act. That all we are going to study in pharmacodynamic. And pharmacokinetics we are going to study what our body did that to the drug, how it is metabolized. All these things I already have discussed. So today we will start with pharmacodynamic. In pharmacodynamics, first thing is drug action or drug mechanism. So before going to the drug mechanism, we have to study about what is drug action, why we need drug, what is pharmacodynamic. So in this video I will describe in brief what is pharmacodynamic, what is things we have to study in pharmacodynamic, and in pharmacodynamic what are the topics we have to study in our coming classes. Today is the topic of drug action. I have already told you drug is one substance or chemical that we are going to take in our body in different action. It can be to reduce any disease or to displace any thing what we have lacking in our body. For that also we are going to drug is a thing which is going to taken for antagonize or for treatment or for prevention or for care. Prevention means before going to any disease, so that that disease can't cause any effect, we are going to prevent by taking different drug. Care means after causing disease, how to inhibit that disease, how to overcome disease. For that we are going to take in the drug. So like that different actions are there of drug that we are going to study in that video. So drug action. So first thing, to going before that drug action or drug mechanism, we have to study about drug action. What is drug action? We are going to take drug for a reason. So how that drug is doing that actions, and what are the actions that we are going to study here. So drug can show its action in different mechanism. That mechanisms we are going to explain in the upcoming videos. Today are going to explain about that drug actions result, how the drug is going to show its action, like, or how the what is the last effect, or what is the last thing what we are going to see after completion of that drug action or mechanism. It can be different types or different result we can see. Like that we can tell inhibition, or we can tell it depression. That means to depress or to lower anything or to overcome anything is called as depression. And that can also be cytotoxins. It can be displacement. It can be irritation, or it can be stimulation. So all that five, that is depression, cytotoxin, displacement, then irritation and stimulation, all that are result of drug action. And how that action or result is going to come, that is called a drug mechanism, that we are going to study in upcoming classes, how it is going to show, how it is going to do. All these things are drug mechanism in upcoming videos. So today we will discuss about the different action, how it is going to show drug result, all that result, how that drug is going to show, and what is that things. Inhibition or depression, we sometimes we heard that to take or to treat any disease we are going to take the drug. Just suppose you have fever, so you are taking paracetamol or any antipyretic drug to depress or to overcome your drug. So how the drug is going, the drug is going to inhibit the temperature or decrease the temperature. To decrease any temperature or decrease any things in our body or decrease is leads to inhibition. And we sometimes we heard that we are going to take any drug that is going to depress our CNS, depress our ANS, depress our like that. All that result are called as depression. Example we can tell. Example we can tell, when our body anti-immunity drug, when our immunity is going to cause any autoimmune disease, to overcome that thing we have to depress or we have to inhibit that immunity system. That time we are going to take anti-immune drugs, that actions is still as depression or inhibition. Some drugs we heard that it act by stimulating different chemicals in our body, like CNS stimulant. Like we heard that coffee and tea are the CNS stimulant. That means they will going to direct action on CNS or central nervous system and going to increase or induce its action so that it can stimulate CNS and it can show its action. That is called as stimulation. Like example, I have already told you, tea or coffee is called as CNS stimulant. That means it is going to show its action by stimulating CNS. Like that, other actions for which we are going to take the drug, that can be irritation. So in depression also I forgot to tell you something. A drug example, we have a headache. For that headache or joint pain or any pain, to reduce that pain we are generally to take different balm like Amritanjan, like different balm we are going to use. What they are doing, they will inhibit or they will depress that pain. That is also one mechanism of action. And we sometimes we know and that when we take any balm in very high quantity, it causes irritation and it causes inflammation. That leads to different action, that is called as irritation or inflammation. Another example is Senna, that is irritant purgative. When we have problem with constipation, we are going to take Senna, that is going to irritate our bowel or irritate our stomach, so that feces or stool going to form in high quantity, so that it can come out from our body as a feces. Example is Senna, it is going to irritate our bowel, so that bowel movement increases and it treats constipation. So that is also another mode of action, that is irritation. So balm, when we are taking that, it is causing inflammation. That is also one type of action and it is going to reduce that pain. That means depression is the action. In Senna is going to irritate our bowel system, so our bowel system, so our the feces will come out through our from our body and it will treat constipation. So that is also one more action. Another more action is displacement. Displacement means to exchange something with the same thing from outside. Just think, if you have vitamin deficiency from your body, you have vitamin deficiency in your body, then what you have to do, you have to take vitamin supplements from outside. Different vitamin drugs are present in our market, so by outside you have to take that drug and that drug will fulfill your requirement or lack of vitamin in our body. So that is also one mechanism of action, that is displacement. Another more example is iodine. If you have iodine deficiency, then it can cause to or leads to goiter. So to treat that thing, we have to take different goiter drug that is going to inhibit or going to replace that lack of iodine. So we have to take the drug that will increase the iodine amount that is lacking on our body. It is going to replace with the whole iodine or that lack of iodine and going to treat goiter. So that is also one more example. That means examples are when you have vitamin complement, iron complement. When you have deficiency of vitamin and iodine, if you are going to take from outside, it is can replace the lack of that complement and can treat diseases. So this will also one mode of action. Last one is cytotoxin. That is very specific action, generally antibiotics or antibodies forming all the drugs. In that, what happens from outside, different antigen comes that create infection in our body. To remove or to kill that infection, we have to going to take different drugs from outside like antibiotic. To decreases antigens, we have to take antibiotic or we have to stimulate our immunity so that it can fight against antigen and it can causes death of infection and it can treat the disease. So cytotoxin is also one of the drug action. Another more example is cancer treatment. In cancer, different normal cell is going to start to multiply if uncontrollably. To treat all these things, also different drugs are going to take or chemotherapy we are doing. That is also one more drug of action. So different drug of action mode is depression, stimulation, irritation, displacement, and the cytotoxin. So in this video, I have shortly discussed what can be the result of different drug action. That means how when a drug is going to act in our body, what are the result it can cause, that I have already have discussed. But how the drug is going to show that all that result, that is called as drug mechanism or drug mechanism of action, whatever we are going to study in the upcoming videos. So in that video, I have already told that all are the result or action of the result, that is drug action result. How it is going to show, that is drug mechanism, that we are going to explain in the upcoming video. Thank you.